Hi, Dmitry. Come on in.
Hi.
You could have a seat right here, please. My name is Jenna Tomai, and you can call me Jenna. And I'd like to first take a moment to discuss my training with you. I'm currently a marriage and family therapist trainee, and basically what this means is that I'm currently in my second year of a graduate program in a clinical psychology master's program. It also means that I'm working under supervision, so I will be discussing your case with my supervisor as well as my fellow trainees. And this can be a huge benefit for you because you'll have several different people looking at the best way to help you. Do you have any questions regarding this? Okay, the next thing I'd like to discuss with you is the issue of confidentiality. And I want to let you know that my supervisor and my fellow trainees and myself will keep everything that you say in therapy private. There are, however, some exceptions to this, and that's what I want to go over with you today. And you also did fill out a form regarding this in the waiting room.
Yes.
Okay, I just want to talk to you about it in person and give you an opportunity to ask any questions you may have, and I also want to make sure that you understand it, okay? So the first exception is if I believe you are in serious danger of harming yourself. And if this is the case, I must take all necessary steps to keep you safe. This can include escorting you to the hospital to receive emergency care. Another exception to confidentiality is if you express a clear intent to harm another person. And if this is the case, I must notify that person as well as the police. Also, if I believe that you or someone that we're discussing in therapy is either abusing or neglecting a child, an elder, or a dependent adult, I must also contact the corresponding agencies such as the Child Protective Services. I might also need to break confidentiality if I'm requested to by court order. That's a document signed by the judge saying that I need to release your records. Lastly, you have the right to share your information with whoever you please, but I cannot release any information or request any information about you from someone else without your written consent. So if you would like this done, we can have a waiver filled out beforehand, okay?
Okay.
And also I want to let you know that if any of these circumstances arise, I will make sure to bring them to your attention and we'll discuss them in therapy, okay? Do you have any questions regarding any of these exceptions to confidentiality? Okay, if you could please initial on the bottom of the form that you filled out. Okay. This just yes, right there. This just verifies that we went over it in person together and that you were given an opportunity to ask any questions, okay? And also, if you have any questions regarding confidentiality throughout our time together, just please feel free to let me know, okay? So I'd like to start by asking you for the reason for your visit today, and then I'm going to go into some general questions about yourself. And when I ask you these questions, I ask that you are open and honest. That will give me a better understanding of who you are and the best way in which I can help you, okay?
Okay.
And also, I will be taking some notes as I'm asking you these questions. This will just be so I can remember some important aspects of your case. But if you would like to see what I'm writing at any time, just let me know and I'll hand my notes over to you, okay?
Okay.
All right. Well, Dmitry, what brings you in today?
Well, I mean, I don't know. It's not anything really specific that happened.
Okay.
Nothing's happened to me. It's kind of the opposite. That I hate the way things are going right now in my life. I feel like I quickly hit a dead end. And I don't know what to do to make things go any differently. You know, I'm just worried that this is it for me. You know, this is as far as I'm going to get. You know, and this is all that I'm going to be able to do with my life and with myself.
Okay, you say that you've reached a dead end in your life. Can you give me a little explanation of where you are currently at?
Yeah, so I finished college a year ago.
Okay.
You know, and I had a very hard time with that. You know, and thought maybe that, you know, once I finish college, it would be a relief and I can go on with my life. You know, and now that I'll have this freedom and all the, you know, difficulty with classes and everything will be over, then now I can just go on and, you know, and start a career, and that, you know, this is kind of the easy part. Now you know, I don't have all this pressure on me. But it's kind of been the opposite of that. Is like my anxiety's gotten the worst of me, and I worry about everything going on in my life. You know, I haven't been able to do anything. You know, since I graduated, I've been working in a restaurant, just thinking that this is, you know, something I can do in the meantime until I really get things going. But I mean, even the idea of actually applying for an actual business job, even the idea of that just gets me so anxious and nervous, and I just, you know, I can't even go near it. You know,
Okay, you mentioned that you have these worries, especially when it comes to applying to jobs and things. Is that the only thing that you're worried about, or are there other aspects of your life that you have these feelings for?
yeah, I mean, I worry about things left and right. You know, I can't even tell you. I mean, it sounds stupid because, you know, I worry about what I'm going to do during the day. I worry about what I'm not doing during the day. I worry about, you know, what's my family thinking about this. You know, I worry sometimes about, you know, what happens if I don't get to the store on time. I just worry about the dumbest things throughout the whole day. You know, and it would make a lot more sense if it was about, you know, something that actually matters. But I mean, I have to tell you, it's just this anxiety just takes over every single day, and I can't get rid of it and actually feel like I'm at rest and ready to move on with my life.
Okay, are there any certain circumstances that trigger these worries?
I mean, yeah, I guess I worry a little more, you know, when I hear from my parents.
Okay.
You know, that definitely stresses me out a lot, you know, and I get a little more anxious when I start thinking about, you know, my job, you know, applying for a job and actually interviewing. You know, that gets me a little more nervous. But I mean, other than that, it's just this anxiety that's always with me about everything, about little things. Like nothing is just worry-free for me. It just never is.
Okay, do you remember when you first started to feel this way?
That's kind of hard to say. I mean, I guess I've always been like this throughout my life. Thinking back to high school, and, you know, I don't know, as a kid, it's hard to remember what it was like when I was a kid.
Mm-hmm.
I mean, I know in high school it wasn't as bad, but I mean, I was always definitely high. Like my friends would always say I'm very high strung. You know, that was always true in high school.
Okay.
You know, and then at college, yeah, I really started struggling and really started to worry about what's going to happen with my life. You know, who am I going to become? Who am I going to be with? What is my life going to be about? Where am I even headed? You know.
Okay. And you mentioned that you struggled throughout college. Was that academically?
Yeah, I mean, it was that, and it was pressure also. You know, I played baseball.
Okay.
You know, back from high school, I played high school baseball, and then I ended up getting a scholarship and playing that in college.
Okay.
And so, yeah, I mean, that was just a huge stress for me all the time. You know, if I don't play baseball, you know, there's gonna go my scholarship.
Mm-hmm.
You know, and if I don't keep up my grades,